Hi everybody! I am bringing you this video today from my front porch, and it's a beautiful day here in Northern Virginia, so I'm really happy to be outside. So excuse some of the external noises, there's a lot going on out here. What I wanted to share in my video with you today is about a topic that comes up almost every day in my clinical practice, and it's such an important concept that I thought I would share some tips and useful information here for my followers on social media. But first I want to just express that the content shared in this video is not intended as a substitute for medical advice, diagnosis, or treatment, and so always seek out the advice of your own physician regarding questions that you have about medical conditions. What I want to share with you is some information about anaphylaxis, and anaphylaxis is the name that we give to talk about systemic allergic reactions that can range in severity but can be life-threatening. So these are very severe reactions. Symptoms of anaphylaxis can span multiple body systems and often affect more than one. And these include symptoms that affect your skin, your respiratory or gastrointestinal tracts, or cardiovascular symptoms. And so what's important to know about anaphylaxis is that people can have severe allergic reactions for several different reasons, and this includes ingestion of food allergens, insect stings, medications, and even treatments for other underlying problems like allergen immunotherapy. And so what I want patients to know about anaphylaxis, in addition to all of the important information that their medical providers give them, I want you to know a few different helpful tips. The first one is to always have a plan. Knowing the symptoms of severe allergic reactions is very important, but it's more important to have a plan in place as far as what would you do in the setting that a reaction occurred. Many physicians will give action plans to patients on paper, and so sometimes they end up in a pile of other handouts at home, or they go directly to school with other important forms that are collected. And so the more important place for this action plan to be is with you all the time. I often encourage my patients to take a photo with their mobile device of their action plan, so that way they always have it on them as an important point of reference. Having knowledge of the symptoms of anaphylaxis is extremely important, but also having a plan in place as far as how to appropriately treat it with medications. Secondly, epinephrine, which is the emergency treatment medicine that we prescribe for patients at risk for anaphylaxis, is important to always be with you. And this is really important because it's often where accidental ingestions may occur, and patients aren't prepared and may not have their epinephrine auto-injectors with them. I'll give you a great example of this. A young lady that I know was out for a walk with her family, and they stopped at an ice cream parlor, and as she got a scoop of ice cream, her food allergen was a contaminant on the scooper and ended up in her dessert. And so even though they were just on a little walk from their home, she had an allergic reaction, and the family didn't have her medication handy. This can be extremely stressful and emotional for families and patients to deal with, and so it's really important to always have that emergency preparedness by having your auto-injectors with you. I say auto-injectors because about 40% of the time, these reactions may be biphasic, which means that the reaction occurs, you may treat it with epinephrine and get better, but the reaction may come back again. And so with that in mind, it's always important to have 2 epinephrine auto-injectors with you all the time. When you get a kit prescribed to you which has 2 auto-injectors, it's not meant to have one for home and one for school, or one in the kitchen and one in your purse. It's meant to keep those 2 epinephrine auto-injectors together in case you need both at any one time. The next thing to know is that you always need to ensure that you know how to use your epinephrine auto-injector properly. There are multiple different brands and generic products on the market now, and so when you get a prescription for epinephrine, almost all of the time you will also get a treatment demonstrator or a practice device that you can use that does not contain medication. It's important to recognize that this is not one of the 2 that needs to come with you all the time. These don't contain medication or any injectable equipment, and so it's important to know these are only for practice. If you don't have an epinephrine autoinjector demonstrator, you can always watch a video through the internet. So you can Google your product, and there are tons of videos online showing proper use. You can also ask this of your physician. So it's very important for anyone who's prescribing epinephrine to always ensure that their patients know how to use them. So as a patient, you should expect this of your provider. So please say, hey, I don't understand how to use this. Can you please show me, okay? Or tell me how to use it. So that's super important. Another individual who can be helpful with this is your local pharmacist. So when you go to fill your prescription, you can always ask the pharmacist to demonstrate for you as well. Epinephrine autoinjectors come in a lot of different versions now, and so most of these are in a pen-like device, which it's important to know that when you use any kind of pen-like device, please don't put your thumb on the end of it. It doesn't have any back-end activation, so we don't want to do that, because sometimes I've seen this before where people will use their epinephrine autoinjectors improperly, where they'll be holding it upside down and they'll end up injecting their own thumb. So it's best to always hold it with a closed fist in the middle, because in that case, if you are holding it upside down, then nothing will happen. You'll recognize it, turn it the right way, and go ahead and use it. So knowing the proper way to use the device is super important. Make sure you know that. The last thing to know about epinephrine autoinjectors and anaphylaxis is that if you ever use an epinephrine autoinjector, it's essential to seek emergency care immediately following. This is very important because patients who are experiencing severe allergic reactions may need other medications in addition to that epinephrine. This may include IV fluids or blood pressure support or respiratory medications or even steroids. So please, if you ever do use epinephrine, seek emergency care immediately. I'm hopeful that this video was very helpful and informative. Again, for the 4 major tips about anaphylaxis, like knowing the symptoms and having a plan, always having your epinephrine autoinjectors with you, knowing the proper way to use them, and knowing to seek emergency care after use. I hope that this was helpful, as I think it's always important to review these concepts so that way, in the case of an accidental exposure to your trigger, then you'll be ready as far as acting in the way that is the safest and the quickest way to get better. It's great to see you all, and I'll see you again here next week.